Tell me, exactly what is hospice?
Well, I guess the best answer I can give you is hospice comes from the same word that means hospitality, and it is care for those people in their final months or weeks of life. It is a focus more on their comfort when a cure can no longer be achieved. So we're focusing on trying to make them as comfortable as possible. People think sometimes about hospice as end of life, but it's really having the best quality of life you can for as long as you've got left.
Is a key word to that, though, a time in life where there's anticipated there's not a cure? Is there a period of time that they anticipate death will occur?
Well, the regulations call for when a reasonable doctor would not be surprised, and we call it the surprise question, would not be surprised if a patient like this, if their disease followed the usual course, had 6 months or less to live.
So 6 months is sort of a key time area.
If that's what they think that's going to happen, but we have a certain percentage of our patients that live longer than 6 months.
When people go into hospice, it's usually, what's the length of time that they will stay there? It's just much shorter than 6 months, isn't it?
Well, it's usually much shorter. Unfortunately, it should be somewhere in the 100 to 120 days. Our average length of stay is in the 40-day range, and unfortunately, a third of our patients come in and are only with us less than 3 days.
So it's really, for those people, it's people that are really at the end of their life for sure, 2 or 3 days left to go.
Yeah, and that's unfortunate because that's difficult to do your job and get the patients to where, the goal here is for them to be able to talk to their family, reconcile, heal in the sense of coming to oneness with their family, and we're still trying to get their medical symptoms under control.
That's a beautiful statement. So with hospice, first of all, I've got a myriad of questions that I want to come down to sort of a summary, but what is available under hospice? Is it doctors, nurses, counselors,
yes,
religious, all the above? So tell me what's available.
Well, hospices are unique in that what Medicare requires is that you have to have a program that has a doctor for medical director, nurses' aides, chaplains, social workers, speech therapists. We have to offer at least a small amount of physical therapy. And finally, we're required by law to have volunteers that can come into the patient's houses and help them with like housework and stuff like that. It's the only thing that Medicare requires that for.
So you can have hospice in the hospital, in the house, in a hospice agency. Tell me about, where do you house the patient with hospice?
The vast majority of our patients are housed at home. The goal is for them to stay home and be with their families, which is where the vast majority of people say they want to be. Unfortunately, only about a third of the patients who pass away are at home, which is where they want to be. There is a hospice inpatient unit that Tennova has in North Knoxville. Very occasionally, patients will be in what we call general inpatient in a hospital. And then, of course, there's the palliative care service that's in the hospital that does a lot of that work as well.
So most of the time it is at home. Now, you mentioned all these services. Are they required for every patient? Do you have to have social counsel, social worker, a priest or a preacher, an aide? Do you
all
have to
of
have
those, the patient is free to decline those services, but yeah, it's kind of like a train stop when the patient first comes in, because all those people have to come in and see the patient within 5 days. And so I tell patients, brace yourself, there's going to be a lot of people coming through for the next couple of days, and then things will calm down a little bit. We also provide medications related to the illness that comes for the patient. That's free to the patient, along with durable medical equipment.
Now, what's durable medical equipment? What does that mean?
Hospital beds, wheelchairs, walkers,
so those are available.
Oxygen, yes.
So you can get a hospital bed to make somebody more comfortable at home.
Yes.
Does the insurance usually cover most of that?
Hospice, at least for Medicare, is 100% covered. As long as they're in the home, everything, medications, the staff, the equipment are all 100% covered.
Well, that's wonderful for the patient.
Yeah.